see my slides?
Yes, please.
Thank you, Jay, for inviting me to participate in this. There have been wonderful cases so far. This patient was first seen by me in November when he came with a mild blur in the left eye vision. In his best corrected vision, in the right eye was 612 N6 and in the left eye 66 N6. He had this scar just above the disc, and you see dilated choroidal vessels above and below the macula. There were a few dilated choroidal vessels in the left eye and a small pocket of subretinal fluid. This was a swept source OCT, which showed this elevated, thickened, localized area of choroidal thickening with small little vascular components. And the left eye showed a small pocket of subretinal fluid above the fovea. And this was the swept source OCT image showing features suggestive of a choroidal hemangioma with overlying pigment hyperplasia and cystic spaces. And this again was the area of the choroidal hemangioma, another area of very thickened choroid below the macula and a small amount of subretinal fluid. And you see the montage picture. This is the choroidal slab showing hugely dilated choroidal vessels above the disc and below the macula in the right eye. And this was his ICG. The fluorescein didn't add much, and in interest of time, I have not put the fluorescein angiogram pictures. The ICG shows a very, very leaky choroid, and you see the wide field ICG angiogram showing that the choroid is significantly leaky at the posterior pole. There's a little bit of dilation of the vortex, but I think this may not be very relevant. And this was the left eye again, showing a very leaky choroid at the posterior pole. Even in this area, there was no specific leak on the fluorescein angiogram to suggest that he had a CSR leak. And this was the montage, the choroidal slab showing dilated large choroidal vessels in the right eye, and you see also dilated large choroidal vessels in the area of subretinal fluid in the left eye. Now just rewind back. This was 2011 when this patient first came with blurring of vision in the right eye, a pocket of subretinal fluid, and you see this orangish mass lesion above the disc. This was leaking on fluorescein angiogram, and if you see the ICG at that time, there's an irregular tangle of vessels with intense leakage above the disc, typical of a choroidal, circumscribed choroidal hemangioma. Notice also that there is a leaky choroid at the posterior pole. This was the left eye at that time showing a small area suspicious of a CSR leak and some pigmentary alterations, again a leaky choroid at the posterior pole. At this time, we did not have a wide field, so this is all I have of the patient. He subsequently underwent 2 sittings of transpupillary thermotherapy to the choroidal hemangioma. The subretinal fluid resolved in January 2014. He came with blurring of vision in the left eye. Fluorescein angiogram showed this point leak for which he had had laser. So to summarize, in 2011, he had 2 sittings of TTT for circumscribed choroidal hemangioma. Best corrected vision at that time was 618 and 12. You see the lesion with intraretinal cystic spaces, subretinal fluid. And then in the year 2014, he had focal laser for CSCR in the left eye. And the notes subsequently say that he was stable. There were a few fundus photographs that we could find. This was the one at presentation. This was 2014. This was 2016. And in 2020, you see this hugely dilated orange choroidal vessel seen in the infratemporal quadrant. And this was the ICG angiogram in 2011 and 2020, showing that this area now has significantly increased in terms of leakage. So at this time, we were a little perplexed. There was a documented choroidal hemangioma. He obviously had pachychoroid. The choroidal thickness was around 600 in both eyes. And now he also had features of CSCR in the fellow eye. At this point, we considered the options. Unfortunately, PDT is not available, and there's very little subretinal fluid, subthreshold laser, or eplerenone. After much thought, I started him on 25 milligrams eplerenone per day and suggested monthly potassium monitoring. A review 1 month and 2 months later, 2-month visit was just 2 days ago. He reported improved vision quality in the left eye, which at 6.6 and 6. There were increased cystic spaces in the right eye, but no subretinal fluid in either eye. This was the first visit with the small area of small pocket of subretinal fluid in the right eye, and now it's gone away. The subretinal fluid in the left eye, which has gone away and remains such after 2 months. And these are the cystic spaces in the peripapillary region, which are increasing, but his vision has remained stable. There's no subretinal fluid. And if you look in the papillomacular bundle, you see that the large choroidal vessels are appearing slightly less dilated now at 2 months. And this was the montage at 2 months. You see that the dilated choroidal vessels in the papillomacular bundle in the left eye are missing, whereas the right eye looks the same. So there are 2 references on elevated choroidal thickness and CSCR in the fellow eye of patients with a circumscribed choroidal hemangioma, and a more recent report that shows that choroidal thickness is increased and irregular in patients with circumscribed choroidal hemangioma. So just to add to the always extending pachychoroid spectrum, I now throw in, is choroidal hemangioma part of the pachychoroid spectrum? Because we know choroidal hemangioma is supposed to be a congenital hematoma that becomes symptomatic only if there is subretinal fluid. But over 10 years, we've seen now a new area of dilated choroidal vessels develop. So what exactly are we dealing with? Thank you.
Thank you so much. All right, who is taking this up? Anand?
Yeah, sure. So, I think it's fascinating and also scary that you suggest that expanding pachychoroid spectrum over the course of the last 2 hours, it's expanded like a band of elastic, actually.
And we forgot to talk about PHCR.
Yes, yes. So, I mean, it makes intuitive sense that if vortex vein congestion can pump up the pressures inside the choroid and lead up to the pachychoroid, this thing, any other choroidal abnormality with a vascular connotation, such as circumscribed or even diffuse hemangioma, can perhaps raise the hemodynamic pressures within the choroidal compartment, and that may lead to this. But I don't know, I instinctively feel maybe the development de novo of a hemangioma, ascribing that to pachychoroid, I'm not sure if that is true. But on the other hand, the hemangioma may, in a patient who's predisposed to high pressure blood pressures, increase the hemodynamic pressures within, and then lead up to this kind of pachychoroid formiferous states that we might see.
So I just wanted to have 2 comments. The left eye, the right eye inferior lesion, which became more obvious recently, was showing some diffuse leakage in 2011 ICG as well. So probably it was pre-existing, it just became thicker and bigger eventually. And somehow in the left eye, I think that the punctate hyperfluorescence, are we sure to call this as CSCR? Was it like, again, a subtle hemangioma which was slowly leaking or oozing in that area as well? So is it like a combination of venous congestion with CSCR, or it is just a hemangioma which is just representing it from a subtle to more obvious manner?
Yeah, I have a comment to make. We had, I mean, maybe not in this case, but we had 3 eyes actually, where bilateral pachychoroid and choroidal elevation at the posterior pole and thickening and outer choroidal loculation, which all produced like a circumscribed lesion. I don't know if Dr. Munam remembers. I had presented it in Delhi Retina Meet, and it was published in Retina as a diagnostic therapeutic challenge with Dr. David Saraf and Bailey Frohn discussing, wherein there was it appeared like a solitary mass lesion
I think the superior lesion, there's no doubt about it, because it's still showing typical features of a hemangioma on the OCT, because you see those vascular channels. Though I've seen the patient only recently, and the typical changes of hyperplasia that occur on the surface. But what was odd was the new one that was appearing. And Jay, actually the ICG of the older pictures is only of the posterior pole. If you look at the wide field ICG, you see that the leakage is almost below the arcade. So only thing is I had not come across, do hemangiomas develop like that?
Yeah.
Or that was what was the question. And it looks quite scary actually, that area. It's quite elevated if you were to look at it in 3D.
Yeah, seeing newer hemangioma in a circumscribed lesion would be absolutely new. Any other comments, anyone?
I think we are still learning. Still learning about pachychoroid.
One question to Muna madam: is it like the new lesion which you showed inferiorly?
Yeah.
Does it have all classic features of hemangioma? Because the ICG
no, it doesn't.
Does not have.
It doesn't.
Hemangioma to me. That's why I said even our case had some atypical features where elevation and observation. One case was observed, one was treated with epineurone, and one with focal laser. That particular had at the edge a focal laser for this choroidal elevation. So maybe you could observe this patient whether before going in for further treatment.
Right now he's on eplerenone and he's tolerating it well. So I said, let's just try it for another.
Yeah. Seeing the vortex vein congestion up to the ampulla could be one more interesting angle to understand the association. Yeah. All right. Thank you so much. Thanks, Muna ma'am, for fantastic case. I think here we finish the cases.